He owns some hospitals. He's involved in politics. He's involved in economics. This man is a truly a Renaissance man. From a doctor, from medical world to the economics to the community work, it requires a lot of scheduling, a lot of time management, a lot of involvement. So when a person does in all the various areas, he balances his life in all the various facets, I am very proud of him. And I salute the man, and I ask Mr. Dr. Shah to address you at this moment. Thank you very much.
Thank you, Mr. Krishna Shah. I will go straight to the topic here, but obviously this is a forum for the business council, and I'm not essentially a businessman, I'm a cardiologist. But I participate in hospitals and in healthcare in the United States. So my address is a simple address, it's a vision statement really for India, for sustenance of the economic development of this country. And it's related to healthcare because I think that for a country to keep a sustenance of its economic development, healthcare should be in the forefront. It's an important topic. In most countries, it forms between 10 to 15% of GDP. And in this country, we have a system. These are my personal observations, and I like to interact to statement on this behalf. But in this country, the healthcare is divided into two parts. One is the private participation, which is outstanding. And you have leading hospitals in this country. They give the latest in technology and innovation. And then there's a public participation of the healthcare delivery system. It is common knowledge, it's a common perception that the private healthcare system is flourishing. Most people in this room, and we're not talking about, and we always talk about our own situations here. Most people in this room have private healthcare. They go to, I'm from Bombay, so they go to Just Local, they go to Beach Candy, Hospital Hinduja, and Lilavati hospitals and get the treatment. But in order for the country to have a sustenance of its development, the common man, the man who's unemployed, the man who's underemployed, the man who's in the government sector, the man who's an underdog, gets the treatment from the public sector. What he gets is only the very basic. There is no way that he can get a system where he can get a kidney transplant or a heart transplant, even though they are available. Now what's happening is that the gap between the private sector and the public sector is enlarging on a continuous basis. No private sector person ever goes to a public hospital for treatment if he can help it. And a person in the public sector will hardly go to a private sector because he cannot afford it. And in order to have the sustenance of that, of the economic development of the country, in all Western countries today, there's universal health care, except in the United States, where it's coming. And healthcare is an important form of discussion this time for the next presidential election. What's important for India, because this is not an overnight decision-making process, it's a process that will require years of participation, decades of planning, and it's a continuous process that will require a public-private partnership. A public-private partnership involves that there is a national healthcare system in the country, and that national healthcare system only can be developed by means of the insurance companies coming to the aid of the common man so that he can participate in the healthcare delivery system by which he can obtain health through the private enterprise. Now, in order to do that, let's take it for granted. If you've got a population of, say, 5 million people in the region, at least 4.5 million of those people will only have a public health delivery system which is inadequate.